Welcome to the Arc of Ohio podcast with Jen and Lindsey. Jen, how are you doing today?
I'm good, Lindsey. I've got one of my kids home and one of them at school. I thought I was going to,
Woohoo!
so I'm actually pretty excited about that. So how are you doing?
Hey, I'm doing okay. Both kids went to school today, which is a miracle.
Love it. This time of year is always tricky. And
I
we just
know it is. I'm pretty sure that this is the first full week that they've gone to school since after Christmas break.
yeah,
So I'm excited.
I'm excited too for you because I'm
Mm.
glad Wit went. Jack, my Jack's at home, and I'm like, please be quiet.
Mm.
Dad's here though, so I
Well,
have.
that's good. I don't have a dad here today. So if Whit stayed home, he probably would have been sitting right beside me, giving you guys the disapproving.
Yeah. I know. I was like, Jack, at least you have to put a shirt on so that if you walk in during the podcast, there won't be a half naked child.
I've been there before. Whitman one time walked behind without pants on, and I'm just like, oh my gosh. We gotta edit. I had to apologize to the meeting and be like, hi, sorry, it's summer break. He's just living his best summer life, guys.
This is what our lives look like, Leann. I'm just telling you. We have a great guest today. We have Leann Magre.
Magre.
Thank you. I'm sorry. You just told me.
No problem.
She is the executive director of Children's System of Care at Ohio Rise. And we wanted to have her here to talk all about Ohio Rise for our families to kind of understand what it is. It's kind of new to us still, even though it's been here for a few years now. And Lindsey and I are both working with you all so much that I just wanted to have you guys on to talk a little bit more about what Ohio Rise does for our families in the DD community. So thank you for being here, Leann. Please introduce yourself a little bit more and tell us what you do at Ohio Rise.
Well, thank you all so much for asking me to be here. I'm very excited and honored to be able to speak with everyone who's listening and share the wonderful work that's happening in Ohio with Ohio Rise. Again, my name's Leann, and I am a clinical social worker, licensed independent social worker. I have done the majority of my work in the child welfare system of care world. I started out in residential treatment a long time ago as a baby therapist and have progressed all the way through. I've worked with children and families my entire career. I've done a lot of trauma treatment. And really just focused on helping youth and families live their best lives that they possibly can. I transitioned to managed care 13 years ago and started working. It was one of the first health plans in Kentucky at the time. I was in Kentucky at the time that had carved in behavioral health. And believe it or not, managed care organizations really struggle to understand how to incorporate behavioral health. Behavioral health providers don't act like medical providers. They don't act like hospital systems or primary care physicians or any of those doctors and other providers that do medical services. So we're very different. We have a very different process that we do. People don't get better immediately. There's not a cure for everything. And as a result of it, some of the work that I've done within managed care has helped to teach managed care how to manage behavioral health. And I was lucky enough to be asked to join Aetna Ohio Rise over 3 years ago and help with the implementation of the program, as well as now do the work that's day to day within the program. So I'm very honored to be part of this whole process.
Great. Thank you, Leann. I didn't realize you were a social worker. It makes sense that you have some background because when I meet with the case managers that I work with at Ohio Rise, it is very clear to me that a lot of them do have social worker backgrounds. Social workers are my favorite. I think Lindsey would agree. When you have somebody on the call or involved who understands that piece, it's very helpful. And then like you said, that behavioral health is not a one-stop shop. It's just a constant thing that we're going to be dealing with. And I'm glad you said that. So, okay. So what is Ohio Rise and when did it actually start? so that families kind of know, when did this happen? Because I feel like it kind of came in like we were like, oh, who is this new person on our team? And then all of a sudden,
Absolutely.
yeah,
Absolutely.
huge.
We will be 3 years old in July. So our birthday's July 1st, and we'll be 3 years old. So we're still a baby in the world of the work that we're doing. But Ohio Rise is actually a very unique and groundbreaking program that nobody else in the rest of the United States is doing. Now, everyone knows wraparound, everyone has heard of all of that, but at the way that Ohio's doing it and the process that it's being done is so new, and the scale is so different. It's one of the most exciting things about the work that's happening is we are really groundbreaking in what's happening. Ohio Rise is a program, we call it a behavioral health carve-out program for Medicaid that serves youth and families who have involvement in multi-system types of services. Behavioral health is the key component of that work, but there's all kinds of different systems that the youth and the family have been involved in some capacity. And there's an eligibility process. You have to go through an assessment to determine, do you meet and need the services that are within Ohio Rise. And then Ohio Rise has some very specific behavioral health services that only if you're in Ohio Rise can you receive those services. So we're serving youth and families who have some complex needs, complex behavioral health, multi-system involvement. And then once you're enrolled through that CANS assessment, the Child and Adolescent Needs Assessment, you are then placed into the level of intervention and care coordination that is indicated through the assessment that was provided. So you get, it's called a tier, and you get placed in a tier 1 or tier 2 or tier 3. Tier 3 is intensive care coordination. Tier 2 is moderate care coordination, and tier 1 is limited care coordination. But all 3 tiers do the same work. It's just the intensity of that service that changes based on that level that's determined. And it's all based on what the family indicated in their assessment around what they needed and what was going on with them. So all of this, the tiers and the care coordination follows the same model. You develop a child and family team. It's wraparound focused. And we follow the wraparound model with that. So the care coordinator gets assigned, the care coordinator meets the family and starts to listen to the family and understand that, we have this CANS and it tells us a lot, but this is the real story behind what's on paper, and starts to ask what is most important to the family, what is most important for their youth that's involved, and that then together they start working on building that team. Youth and families, when they come into Ohio, already have a team. There's already a lot of people that are working with them in some capacity, and Ohio Rise and the Care Coordination Service brings that team together, because often the team is working in silos. Some don't even know that the others exist. And we bring that team together in order to work as a collaborative force to support the family together as within that wraparound model. And depending on the level of intensity of need, that team will meet once a month, every other month, every 3 months. It really depends on the need and what the intensity level that the youth and the family really need for support. So that's the care coordination part of the service. The rest of the services also include, intensive home-based treatment, mobile response services for crisis, psychiatric residential treatment, and flex funds, which is a really unique benefit that a lot of, well, Medicaid typically doesn't pay for flex funds, period. And the fact that Ohio Rise has that is really, really cool. And then, you know, other services, we cover every behavioral health service there is, and we created a few along the way in order to help support the youth and families. And that's actually my job, is as building the system of care. I am to support the care coordination service. I also support all of the other services that are in play, and then I get the one fun job of helping to create unique situations for families. Sometimes it's unique to the actual family and youth. This works for this family, this youth at this moment, so we're going to do it. Or it's building a larger program that a lot of families and youth might be able to access.
That's a lot. It's great. Tell me more about the home-based treatment, and the mobile. I want to talk about kids in crisis, because I feel like that's a lot of what Lindsey and I see when we're pulled in too. It's always when people don't call us when things are going well.
Right.
So and there's usually we're hitting a wall, or the child, or they're calling us because they need someone in their house basically to help them, or what's we don't want, and what's really hard is the need for residential treatment or inpatient care. That's kind of when you guys are pulled in. So tell us about when a child's in crisis, and I know this is very specific, based on the family and their needs, but what could a family ask for if their child's inpatient at Cincinnati Children's and they're gonna be discharged, and the family's like, oh my gosh, what, we need help still. I am, I have other kids, I have a lot going on, I have a full-time job, I have a lot of this, and I think Lindsey does too, where it's what's going to happen now? What is that, home-based treatment, or is that when they use flex funds to find somebody? Or I want to know about the behavior part, because I feel like we can find someone to come in their home, but they're not the person we need to come in their home. We need somebody who's trained in behavior.
Right. Well, and that's why it's so important for the care coordinator and the family to get together immediately and start talking about the need across the continuum of, what does your life look like, and where do you need that help and that intervention? And so the scenario you put forward, a youth is discharging from Cincinnati Children's. What are we going to do? Because hospitals don't cure anybody. They just deal with the crisis at the moment and keep in safety, and maybe adjust some medication, but then back to the community and home it is. And while the child is in the hospital, the planning has to happen for the transition. And that's where the care coordinator needs to connect with that family immediately, involve that inpatient provider, involve the rest of the team that's already been functioning, and let's figure out what are we going to do. And there's so many different options that can happen. And this is where, if the care coordinator and the case care management entity, or CME, that employs the care coordinator to do this work, are at a loss of what to do. Let's say the family is in a rural area of Ohio, or there's always a wait list of something to get something. That's where you bring in Aetna as well. And we'll come to the table and we'll sit too, and we'll help to plan out what is possible. And there's so many different things that can happen. Now, I mentioned intensive home-based treatment, IHBT. That's an Ohio Rise service. And I hate to use acronyms, but IHBT is a specific service that helps to support youth and families in their home. It's therapy, and it's intensive therapy. They're in there 2 to 3 times a week, 2 to 3 hours at a time. There's a crisis component to that service where a crisis plan is put in place and you can call the therapist. And this is a licensed entity that's in your home providing this care. It is not long-term. It's very intensive and short-term, but it's there to help kind of ensure that you get some real good skills in place in how to manage things in place to support the family once the service is done. So that's a possibility. We've been very lucky in the last year. IHBT has been expanded. OMOS and ODM have worked really hard to enhance the services that Ohio has access to. And IHBT is one of those services that has expanded. So there are providers in just about every county in Ohio today. I think there may be 6 or 8 counties that IHBT is a little more limited, but it's available. There's still wait lists though. So if there is a wait list, then okay, what are we going to do in the meantime? We know this service is necessary, but what are we going to do in the meantime? Then that's where MRSS or mobile response services for crisis can come into play. And we're very lucky in this regard too. ODM is in the process of expanding and blowing MRSS across the entire state. So there's going to be access to MRSS for anybody in Ohio, not just Ohio Rise kids, but for anybody in Ohio to access this as a crisis response. And that's coming down the road. It's in play right now. We're working on implementation and all of that kind of stuff right now, but it's going to give an opportunity for youth and families to be able to access something immediate for crisis in their home. And then from there, the planning of what to do next can happen. So that's an option, but that's not something that as someone discharges from the hospital, you know, they're going to be in your home tomorrow. That's more of when you need them and how you access them. That's what that is for. But we plan it out. We'll even get an MRSS provider in on the plan and say, when you get this phone call, these are the things that this family needs you to do. We can do that kind of planning ahead of time, or it can just be, I'm picking up the phone and calling. And we want to do that instead of going to the emergency room or going to the hospital. We want to do that first. It may end up in the emergency room anyway, just because that's the need, but we want to start there with MRSS. So that's another option for planning. But then there's so many other things that can be done. Behavioral health respite is another service that's unique to Ohio Rise. And we are growing our respite services, trying to just get as many providers as we possibly can. It's a harder service to, because anybody can be a respite provider. That's the wonderful thing that Ohio has brought to the table here, is you don't have to be a behavioral health organization in order to be a respite provider. You can be grandma and be a respite provider. You can be a neighbor and be a respite provider, but you still got to enroll in Medicaid and you still got to bill. And those are the aspects of the service that make it very hard for grandma and neighbor to do. But we're in the process of building a system to where there's an arching organization that does that work for, and then you can just go and do the service yourself. But that service gives someone can be in your home helping, or that you can take your youth to that provider and they can then provide the service. You get your break, or you get time to go take care of other things that as a parent you got to take care of. We've got parents that use respite so they can go to therapy themselves, because it's necessary to take care of us as we go through and take care of our youth and our children. So that's a service that can be put in place to help support when discharge is happening from an intensive level of care service. Another service that Aetna has put on the table as a unique, and this is not part of Ohio Rise, but this is what Aetna brought forward, is called a behavioral health one-on-one. And this is a little harder to, because it's not a structured service and it doesn't have all the pieces there, but we can find a provider that's willing to put someone in your home and provide that one-on-one service, and we'll figure out how to do that, how to pay for it. And it's usually very time limited. It's usually very specific to a specific need, but it is something that we can figure out how to do. Aetna has to be at the planning table. That's not something a care coordinator is going to be able to do on their own. We have to be at the table. We have to help support, and we will do that. But that's not an easy service to do, but it is one that we can absolutely talk about doing and have done. In fact, we have some kids that have 3 behavioral health one-on-ones at one time, because that's the level of need that they have to be in order to be safe in their community. So that's something that can happen as well. And then, of course, we have there's other treatment models that we can look at and bring in. So there's lots of options. We just have to sit down and talk about what the need is and figure it out together. And as you said, every situation is different and every situation is unique. So you can't just cookie cutter it and say, okay, we're going to put this and this and this in place and go, family, go. No, we got to sit down, we got to talk. And then once the services are put in place, you got to circle back around and are they working? Is it doing what we want them to do, what the service to do? And if it's not, then okay, let's change it up and let's figure out what needs to happen.
Yeah, I think that's what families like. It's so great to have people on your team. And but I had this family a couple weeks ago who was like, I mean, my daughter has like 25 people on her team and we still aren't getting the help that we actually need. So like, and this is a child who has autism and some mental health concerns and lots of stuff going on, which is a lot of what we see, you know? And so how can you kind of clarify, this is what Ohio Rise does, and then this is like what your county board of DD should be doing? Because I'm, as the advocate, Lindsey and I are always kind of on there being like, thank you, Ohio Rise. I appreciate you guys doing this piece and you guys are great. But now the board of DD needs to come in and help because deprived child needs a waiver for support, long-term support, when we want to keep this child in the community. Or this child needs that, you know, we need to be putting them on some more behavior. I mean, I love that you have the behavioral health, but you said it's like limited, and a lot of these kids need a lot more.
Yeah, yeah,
So how do
absolutely.
we clarify that? Because that's kind of.
Yeah, I think that's one of the things that we're still kind of figuring out. Ohio Rise, again, we're 3 years old, almost 3 years, not even 3 years old yet. And so we're a baby part of the system of care at this point, and we're still trying to figure out, and everybody else is still trying to figure out, how do we all play in the sandbox together? And that's all okay. That's all okay. That's part of the transformation in moving and doing what needs to happen. In some counties have it figured out, and some counties are still trying to figure it out. And so that's one of the things that it's unique based on where you're at and what the situation is. So as Ohio Rise, we are there to support the behavioral health and the care coordination piece of the work that needs to happen. And as the care coordination service, we are to facilitate the bringing of the entities in that need to be in. And the family voice has to drive that and has to demonstrate that. But once they're in, once people are identified as we need this support, they need to bring to the table what they do as part of it. We did not take over and start doing what the board of DD does. We did not take over and start doing what other entities are charged to do within their community. We came with specific services and specific options that are behavioral health based, and that care coordination facilitation process to bring the entire team together. That's our role in the process. We still need everybody else to do their role, but we're figuring that out because it's resource. Some people have, some counties have really great resources and they know how to manage through. Some don't. And it's like, okay, Ohio rises here, so we'll back away and we'll let them manage. No, we need everybody doing what they need to do. And it's not smooth and easy right now. So we're still trying to figure that out. We're still trying to figure out how to work with each other, and how to ensure that one entity or one service or one support doesn't step away expecting Ohio Rise to do it, because that's not our role to do everything. Our role is to do what we're good at, and we still need everyone else to do what they're good at. So to answer your question is, we're still working on it. We're still managing it. And I can believe that there's probably 25 to 30 people at a team meeting and you're still not figuring it out. And that's because we really haven't, I mean, there's so much complexity to the needs of a family and a youth that it just, sometimes it's just hard to figure it out.
Yeah. I'm going to ask you this and talk, and we can just discuss because I didn't give you this question beforehand, but when you were talking, it made me think about just policy wise and Medicaid and all the things we're hearing in the news and what our Ohio budgets are going on right now. And depending on what the federal budget does, it's going to affect our Ohio budget. So because Ohio Rise is so new, do you feel like there's like a threat to that funding at all? Like if we have some cuts, or do you think we're okay because Ohio Rise is such a great system and it's working real well that the funding for that is okay right now? And you might not know the answer to that, but would you?
And from my perspective and where I sit, Aetna, Ohio, we don't have any concerns. Now, there's
Good.
still all kinds of stuff happening and
Yes.
decisions occurring, but we're trucking along. We're not doing any contingency planning. We're moving. And so I don't really foresee anything affecting. But I mean, tomorrow's COVID may happen again, and Lord knows what happens there. So it's not something that I can, 100%. We're here to stay.
Yeah.
Right now, we're trucking along and we're moving forward, and we have no plans to change. In fact, we're expanding and growing and trying to
That is
put new
awesome.
stuff in at as much as we possibly can. So, and it's very exciting work because again, IHBT has expanded. MRSS is getting ready to expand. We've got psychiatric residential treatment, PRTF, which is brand new in Ohio, and it's growing as well, and working to support youth and families through that. So there's a lot of good growth that's really happening through that process. So I'm excited. I am not at all worried at this point.
Yeah. And then just to follow up on it, I mean, Ohio Rise is a waiver. So like we're trying to keep kids in their home and community-based care. So I think a lot of families that we are helping, sometimes the family's like, this is too much and we need to look at residential treatment. And of course that's something that we can help with. But to be clear, like there is no residential treatment option for a lot of children, like a lot of kids, and I'm dealing with kids in 10, 11, 12, 13, like this is it's tough. So I'm really glad that we have this option now because there's just not that option anymore, which is to be clear, like we were trying to get away from that, like and try to keep everybody in their home. But the rates of like the mental health concerns of our kids, and especially after COVID, I think we got hit pretty hard, which I'm guessing is the impetus of why this all started, right? Because of what happened during COVID and why we needed this extra waiver system.
Yeah, well, one of the things that, and I started my career in residential, and so I have seen what works and what really doesn't, and youth and families with one of our CMEs yesterday, and I asked him, I'm like, if who in here has been hospitalized or had to receive some kind of treatment in a facility? I'm like, did you want to be there? Did you feel like you were getting better there, or did you want to go home so that you could recuperate, and you had to get your treatment, but you wanted to go home because recuperating happens at home, getting better happens at home. And that's really and truly what we have to look at within our system of care. Inpatient and residential treatment are services that treat the immediate acuity that's present, but kids get better when they're at home. Not, I mean, they do get better in residential treatment, but they don't really start to heal until they get home with their family. And it's really a very important concept that people in Ohio need to understand, because we do not want our youth to be, and I've worked in different states and in other places. I've seen kids live in treatment for years, and that is not helping in any way, shape, or form. We are so very blessed in Ohio that we have this option. But we as a system of care have to be very careful how we use that as an option for treatment, to ensure that we are meeting the actual treatment need within the facility, and then working very diligently for that return home to occur. And you're right, there's a lot of youth that there are no residential options for. They need it. They really need it, but there just aren't any residential options for. And we're working to figure out how to create that. That's another part of my job, is what's our need and where do I go to get it? So, I'm meeting with out-of-state providers to understand what they currently do and how can we use them better. And then I also work with our in-state providers to ensure they're doing what they're supposed to be doing, what they've been charged to do. And then what else do we need to grow, and how do we get that grown? One of the things that we are very, very lucky to have is we have a couple of facilities that do treat individuals just with developmental delays and autism. That's I worked in Kentucky. We don't have a residential provider that does that. We have one, and it's one that I helped to build because I had kids. I had a couple of kids that were living in hospitals. They had autism, nonverbal, unable to live at home, in foster care. And there was no place for those kids to go. And a provider stepped forward and said, we'll figure it out. And we stepped forward and said, we'll figure out how to pay for it. And we did. And Ohio already proactively did that without hesitation. And we have a great service that's in place as a result of it. But it's every day I am talking about what kid needs what. I mean, I know these kids' names. I know their situations. We are meeting constantly to figure out what's the need, where do we need to go to build it, where do we need to go to get it, and it's really humbling in a lot of the fashion, because it just is. I'm lucky to have my job. I really am.
We're lucky to have you, Leann, because you
Yeah,
clearly
we're
are making Ohio so much better for our kids. Because just when I was telling you and someone else at Ohio Rise that I am on these meetings a lot, and sometimes we're not figuring out, but the Ohio Rise coordinator, these people are like my people. Like, I feel, because they're social workers and they know, and they're not stopping, and they're almost like little advocates for the family too. Like, they're really like trying to pull everybody in. So I'm grateful. I do think we have a ways to go to make sure it's like everything's on the ground and we have it all working, but like it is like a 3-year program, and I already see some good things. And so thank you so much for giving us all this information. Is there anything I could give to families, like just how to access Ohio Rise. Like, I think Cincinnati Children's does a really good job of getting you guys involved. Our county boards do a good job. But if they don't have those two places helping, how would they get in touch with Ohio Rise to get you all involved in their case?
There's all kinds of ways to do that. The county has a care management entity that is functioning in that county. We have 18 of them, and across all of Ohio, and they serve catchment areas. That's what they're called. There's 20 catchment areas, and we have 18 serving 20 catchment areas. You can call and ask them for support. You can get on Aetna's website, and there's all kinds of links there. There's phone numbers there that you can call. You can call your managed care organization, who's providing your Medicaid today, and ask them for help. They can do the CANS assessment and get someone enrolled in Ohio Rise very quickly. There's over 3,000 CANS assessors across all of Ohio. So I'm sure you can call whoever is already providing services for you right now and say, how do you get in touch with someone with Ohio Rise? And they'll probably know how to do that. But if all else fails and you don't know how to do it, give me a call. I am more than happy. You can include my email address if you want in this. Very happy to help and to answer any questions, and I'll get you to the right person that you need to get to for sure.
Awesome. Thank you, Leann. I appreciate you coming on the podcast.
Thank you so much.
And keep doing what you're doing. We appreciate it. Take care.
My pleasure. Thank you all for asking. And anytime I would be glad to come back and participate in any way.